Hi, I'm Andi Lew, and you are watching Well To Do. It is the podcast that brings you abundance in how to feel optimal wellness. Now, this is something that's really exciting to me because we're bringing on a special friend and sponsor. So the friend is Dr. Landon Pryor, who's done some great work in the breast implant illness and explant space. But what if you could supercharge your food, your water, even your skincare, and perhaps even your makeup? Well, that's what the Leela quantum technology and the Leela quantum block does that's sitting with me here on set. And also I'm wearing a necklace from Leela quantum. I know it sounds like science fiction stories, but trust the science and check out Leela Quantum's research. They've got tons of it. It'll help you to neutralize the EMF exposure that's around us all day, every day, even microwave energy, 4G, 5G, and just help you to feel a whole lot calmer. So thank you to Leela Quantum. And now let's introduce somebody that's been really well known in the explant space, which is removing breast implants and beyond, which we're going to learn a little bit more. Dr. Landon Pryor, you have come all the way from Chicago and Florida, two practices.
Most recently from Chicago, but
right.
Yes, we got practices in both locations.
We need you everywhere, it seems. And I guess what's really important is that you've started opening up the space even further, because I've written this book, Treasured Chest. It's about exposing explants and empowering you. But at the time that I had my explant, there wasn't enough explant surgeons. And so now you're really spreading with the BII Centre of Excellence and hopefully getting more ladies who are feeling sick with breast implant illness actually well.
Absolutely, that's the plan. There's such a need for people to do explant surgery like you experienced. There's just not enough surgeons to supply the much need for these patients that are suffering and unable to find solutions.
Well, exactly. So we are going to go into the laundry list of what kind of symptoms and suffering these women are experiencing. And it is, quite sad and shocking, really. I mean, you told me you see it all day, every day. And I think it's important for the people who are watching to join the dots or to share it with their loved ones who've probably experienced, comments of I've got a headache that's not going away, or I've got brain fog, and, we'll go into that soon. But I want to know why you're so passionate about explanting, because it's not all you do.
Yeah, that's right. And I've actually gotten increasingly more passionate about it as I've learned about it and as I've gone through my own health journey. I started on the path of BII explant surgery predominantly in like 2017, 2018. And what, really drove me and drove the growth of the practice was seeing these patients get better, patient after patient, to the point where I was no longer able to justify putting implants in. And so really there was just such a need to be able to help these women that are suffering from breast implant illness. And, for me personally, I've always been a very holistic person. And when I went through my own health journey in the last 12 months or so, it really allowed me to feel what these patients that have breast implant illness are going through on a whole new perspective. Previously, I was able to do it intellectually as a surgeon, as a doctor, but never as a patient. And having gone through it myself, I came out of that illness with a newfound commitment and passion to helping patients find solutions, because I know it's very frustrating and challenging in traditional healthcare to get the information they need and to get better.
So as a certified board in plastic surgery, what you're saying is that you sort of, I guess, flipped your business model to Explant because you saw the need, you saw the women suffering, you believed them, which is important because a lot of surgeons don't even believe that BII is real, or breast implant illness isn't an official diagnosis right now. But then moreover, you're saying that you experienced something similar. Now, just for the people who are watching it, you didn't have calf implants or anything like that. You actually experienced an environmental toxicity that gave you similar symptoms. So let's talk about some of those breast implant illness symptoms so people can recognize if that's happening for them.
Sure, absolutely. So, my symptoms were very similar to what we see with patients, and it's really these kind of chronic inflammatory conditions that can be nonspecific. So brain fog, fatigue, myalgias, joint pain, rashes, hair loss, weight changes, typically weight gain, other neurologic symptoms. And so ultimately it's, the end result of these inflammatory conditions. In my case, it was a combination of obviously emotional stressors, like I had some family issues, work-related stress, on top of a mold exposure and some, heavy metal toxicity, possibly long COVID. But at the end of the day, they all ultimately create the same types of symptoms that we see in our BII patients.
Which leads me to someone who has been teaching health and wellness and holistic health and healing for more than 3 decades now, that when we actually treat the body to heal, it's kind of the same premises. It's getting the body back to balance and removing the inflammatory drivers. Otherwise, we create this perfect storm, if you like, which is the cytokine storm, the immune response, the inflammatory response. And talk to us about how important it is to not only remove the inflammatory driver of the breast implant itself, because it doesn't matter whether it's saline or silicone, it's still an inflammatory driver that's a foreign body within the body, from your understanding, and the body wants to expel through an orifice anything foreign or toxic, and it's got nowhere to go. And then tell us what happens. What's your experience?
So these implants, in my opinion, in genetically susceptible individuals, which means they've got certain genetic predisposition to having inflammatory conditions, they're unable to appropriately detox the implant, and because of their predisposition, they develop these inflammatory symptoms. So what the body does to try to get rid or expel the implant, like you said, is it ramps up the immune system, it creates this cytokine storm, it walls off the implant with this inflammatory capsule, but obviously it can't get rid of the implant, so it causes this chronic inflammatory condition that the body ultimately has to detox from, both by taking the implant out, removing the source, and then obviously addressing all of the damage that's been done at the cellular level to make sure that the patient recovers completely.
Right, and that implant itself, it doesn't have a blood supply. So as you say, the capsule, which is the scar tissue, as the body is with its innate intelligence walling off this foreign body in a way to adapt, because the body is so incredible at adapting to, toxic stressors. But there's limitations of matter. So the symptoms start. So let's go through again some of those symptoms, because at the end of the day, people go, well, I'm not sure if it really is breast implant illness or it is mine, or I really, but at the end of the day, everyone feels better when they get it out. So if you have a genetic predisposition to X, Y, or Z, you're just going to do better off without this.
Yeah, and that's what we tell patients when they come in. We can't definitively say this is your breast implants causing your symptoms. Obviously, there can be a lot of other potential causes, but what we can say is if we take the implants out and you get better, it's called a de-challenge. Essentially that's diagnostic and therapeutic, meaning, we're taking the implants out, and also it's telling us that it was the implants that were causing your symptoms. So, like the symptoms that I mentioned previously, patients come in, we set appropriate expectations, we talk about realistic outcomes after achieving. We can talk about the technical aspects of doing the surgery, but ultimately the vast majority of patients, and this has been well documented, 90+% of patients get better after explant surgery.
Yeah, that's huge stats. And I always wonder about the 10%, what else was going on for them, which we will go into a little bit further, the emotional aspect and things like that, because when you're getting ready to shed, there's so many layers. It's not just the physical detoxification. And I can speak from experience as well as my research. But I find this a really interesting topic, and I need to address it with you. We're talking about en bloc, which is ENBLOC. It's an oncological procedure of removing the implants, versus total capsulectomy or complete capsulectomy, where you're removing part of that scar tissue or that surrounding, capsule. What is the difference? Why are some health professionals and surgeons saying it doesn't matter whether you remove this scar tissue or not? What's that about?
Yeah, it's still what I would consider somewhat controversial in academic settings. And so to answer your question, an en bloc capsulectomy is a term that was actually used initially in cancer surgery, like you said. So that basically means we're taking out the implant and the capsule altogether, just like you would take out a cancer. And that's to prevent the spillage of the contents of the implant into the body cavity, just like you don't want the cancer to spill into the body cavity when you remove a cancer.
And that doesn't necessarily mean a saline implant that's gone moldy, which is very possible, or the
saline or silicone.
Or silicone that, whether you've got the rupture or not, you've still got around the outside of the bag heavy metals wanting to leach into the body, right?
Correct. And so to answer your question, so when you do an en bloc, that always means you're doing a total capsulectomy. You're taking out the implant and the capsule altogether. When you're doing a total capsulectomy, that may not be an en bloc, meaning we may go in, or somebody may go in, it wouldn't be me, but go in, take the implant out, and then remove the rest of the capsule.
Why wouldn't it be you? It might be you.
I'm going to tell you why.
Okay.
But so in that case, you're still getting all the capsule out, but you're not doing it en bloc, which in my opinion is not the best way to do it. Reason behind that is because, like we've talked about, there could be potential spillage of the contents, especially if it's a silicone implant. And like in your case, there was a silent rupture, it wasn't picked up on MRI. You get into surgery. They always say there's no such thing as surprises in surgery, just surprise surgeons. So,
really?
Yeah, I learned that from one of my mentors in training. So
surprised surgeons.
There's no such thing as surprises in surgery, only surprise surgeons. You don't want to be a surprise surgeon. So you don't want to go into surgery with the expectation that, this implant is together and I'm going to take it out and then do the capsulectomy and find out, oh geez, there's silicone spilling everywhere. Right. So we just avoid that by doing this quote unquote en bloc capsulectomy. So we take the implant and all the contents and the capsule all out together. That's the en bloc capsulectomy.
Peeling away the egg shell from very delicately.
Yes, and some shells are thicker than others. Sometimes patients have capsular contracture, which make the actual removal easier. But at the end of the day, we're taking everything out together. And so that allows us to take it out without risk for spillage. But I think also more importantly, there's a lot talked about right now with ALCL. I'm sure your viewers are probably familiar with that, BIA.
Well, for those who aren't, it's anaplastic large cell lymphoma.
And so that develops, it's in the capsule around the implants. And so
this is a new type of breast cancer, you guys. This is interesting to bring up because it's not the only breast cancer that's starting to be found.
It's a lymphoma, yeah. So it's from the chronic inflammation. This is how cancers start. This is how lymphomas start. So
and
you have an implant,
squamous
cell has been found in capsules as well. So you have the implant. You have the inflammatory cells attack the implant, like we talked about. It forms these multinucleated giant cells that are not able to engulf the implant, obviously, so it incites this inflammatory response. And what ends up happening is, you develop these symptoms of BII. So,
wow. I mean, this is heavy. I mean, we're just talking about it like you and I talk about it all day, every day, right? But for the average person that might be listening right now, this is really heavy for them to grasp. Yeah,
it's a lot. It is a lot, and we're doing the best we can to educate potential patients all over the world about breast implants and breast implant illness, but I do think it's important to express to your audience, again, with the total capsulectomy or the en bloc capsulectomy, you're removing that possibility of developing a cancer within the capsule. Obviously, that's something that patients are educated about nowadays. They read about that online. And even if they don't have symptoms of a ALCL, who wants the possibility of having that develop years down the road? So we take out the implant, we take out the capsule, we send that to pathology, they evaluate it, they make sure that there's no hidden cancers or anything like that in there, and patients have the peace of mind, and we're able to also prevent potential recurrences of symptoms down the road by removing the capsules, which is this inflammatory tissue that incites the inflammatory process that causes these symptoms.
Yeah, so ladies or they, thems, if you are thinking of removing your implants, so important to, get everything. And it's a much bigger scar. It's a lot more hours on the table, and it's also more costly. So there have been some surgeons going, we'll just get them out anyway. But, that's versus a potentially 2 to 4 hour surgery versus a 20-minute surgery.
There have been studies that show that patients are able to see improvement in symptoms without capsulectomy. Now, that being said, what we do in plastic surgery is all about informed consent. Whether it's aesthetic surgery or reconstructive surgery. So, we talk to the patients about what our best practices are to improve their symptoms and allow them to recover as completely as possible. And so it is a longer surgery. It will be more expensive. There's more risks involved. And I think to your point, it's a more technically challenging surgery. You have to have, really good technical skills to be able to execute it, to do it properly, to prevent complications. So there are considerations that patients need to be aware of when they decide to do a en bloc capsulectomy with their explant.
So you heard it from Dr. Landon Pryor, a surgeon who does this all day, every day, that it's important to remove both. If there is a surgeon that's perhaps telling you that it's not necessary, I would say Dr. Hop until you find the right surgeon. My diagnosing doctor was very adamant adamant about that, removing it all of it. And I'm glad that she did. She's got 31 years clinical experience in medical practice, etc. But yeah, as you say, you're preventing potential cancer down the road. And
yeah, I'd be careful about saying preventing potential cancer, but removing capsule that potentially could be harboring a hidden cancer that may not manifest until many years down the road.
Thank you for correcting me. And by the way, full disclaimer, anyone who's watching, this isn't medical advice. This is for pure entertainment purposes, and also to whet the appetite to go and learn more and talk about this with your healthcare practitioner of choice. So moving forward, I have my own theories, and this is just my personal opinion, that, we're being discouraged from having that complete capsulectomy or the en bloc procedure just because then we don't have as many successful suits against the product manufacturer or the original implanting surgeon, because you haven't got something that you can necessarily send off to the third-party labs to be tested for those extra things.
I think there's definitely some potential there. It's tough to speculate, why there's so much controversy around capsulectomy and en bloc capsulectomy. I've done a lot of my own research. I've read the world literature on en bloc capsulectomy, and I have a really good understanding of the potential risks and benefits. And so as a ethical plastic surgeon, it's my job to inform the patients of what those are and let them make the decision. But ultimately, it would be my recommendation as an explant surgeon that's done hundreds of these types of cases and have seen patients recover after en bloc capsulectomy, and see patients that have not recovered after taking an implant out without the capsule that then have to go back to surgery and do a completion capsulectomy. I just couldn't in good conscience recommend that to a patient.
Yeah, fair enough. Look, we just need more studies, and not being able to test the women, that are feeling better after. I mean, look, more research is needed, and I believe a new name for breast implant illness, because it's not just the implants or the breasts that are being, troubled or sick. It's the entire system. It's an immune response. So, perhaps we'll change the way the profession practices in time, but we have been supercharging our water with the Leela Quantum block, and I just would love to take a sip, because it doesn't take too long for this to actually work.
Is it? Okay.
You can even improve the quality of your houseplants by giving them this water, but if you really want to, because we're made up of water, you could probably even put your hands in here and supercharge the energy field in your hands. This is just, quantum energy. So in this note, as we're sort of relaxing, I'd love you to tell us about a cool case study where you've really changed someone's life.
Yeah, I don't know if I would call it cool, but definitely impactful. And so some of the most impactful patients that we've treated, some have gotten better and others have not. And I think we have the opportunity to learn from both of them. So I've treated patients that have had very debilitating breast implant illness, like one of my main advocates that got sick within months after having her implants placed. And, a lot of these women are literally bedridden within months, if not years, after BII. And they go to their physicians and they get diagnostic tests and labs, much like I did as a patient, pretty much non-diagnostic. They get clumped into some inflammatory category. And this is what happened with the patient in particular that I'm referencing. She was a competitive bodybuilder. And ultimately, we ended up doing her surgery. She was suicidal, like a lot of these women are. Because, like I said, it is a neurotoxic component in the implants. And after explant surgery, she recovered. She got back to her normal lifestyle. She was obviously extremely grateful, like most of these women are, to get their health back. But unfortunately, not everybody is able to find a surgeon in the right amount of time that has the right skill set to be able to do a successful explant surgery. So, there's another patient that comes to mind that previously had explanted elsewhere, actually somewhere here in Beverly Hills, and did not have a total capsulectomy, did not have an en bloc procedure, had an implant removal, had spillage of the silicone, had persistent symptoms, did come back and have a completion capsulectomy, but by that point...
And how do you get rid of the silicone as well that's spilled inside the system?
I don't know. That's a good point.
Yeah.
And that's why we want to prevent it. That's what the en bloc's designed to do, because once the silicone's in the body, there's obviously ways we can mechanically remove it during surgery, but Like this patient, I think there was probably silicone left behind, and she had systemic silicosis. It was in her lymph nodes, it was in her skin, and she's better, and we've done a lot of, detox with her to try to minimize her symptoms, but she's still very sick. So, like I said, I think we can learn from both examples of patients on what to do and what not to do.
And really important to understand that when a patient does feel suicidal, when they've got the implants in, they're having the breast implant illness, it's not just because, oh my gosh, how am I going to look? That's just like, I think 20% of the whole story is adjusting to, the bigger scars and the flatter chest. I think it's not necessarily even a history of. What it is, and I can speak from experience, the body's literally shutting down very slowly, and you're just not working in the way that you're designed to. So the gallbladder, the liver, the natural detoxification pathways just aren't working anymore.
Yeah, absolutely. And obviously nobody wants to live that way. Having, like I said, been through it myself, I can relate to what these patients are going through, especially it becomes increasingly frustrating when you can't get the validation from the doctors or from the traditional hospital systems or healthcare systems to actually have a diagnosis. And these women are all saying to themselves, I know something's not right. I don't feel like myself. I've got brain fog. I've got fatigue. I never had that before. What could it be? I got implants, a couple of years ago, but nobody
believes me.
It's not that they don't even believe them, but they don't even think about that possibility. And if it is brought up with a healthcare professional, often it's discouraged. True. And they're told that they have anxiety or depression or marital issues or perimenopausal. You've heard all. Hormonal.
You're just a woman.
I wouldn't say that. Yeah, that's gonna get the doctor in trouble. But
there are a lot of doctors and women are saying, as they're hiding in these subculture, online groups, privately supporting one another, sharing pictures and stories, that they feel medically gaslit. There's a lot of people and in this profession that are saying, and I got told you're going to look saggy. You're 50, and I look fantastic. I don't even care if I'm going to look saggy, because what's wrong with a little bit of sag anyway, you guys? Which kind of leads me into that empathy and understanding around, holistically looking after the patient. And you keep bringing up that you've been through something similar, so you're very compassionate in, I guess, having gratitude for having been through something that
absolutely
you can now show extra compassion, perhaps. Whereas we're only a reflection of who we are in practice based on what's going on in our personal lives. So
I'm human like everybody else, right? So yeah, absolutely.
So you want to go to the person who's evolved or gone through something that can have that understanding. So having said that, in Australia, the mummy makeover terminology is actually illegal to use in marketing, materials. And I find that so interesting because, who are we to say that a mum who's actually given her body to a child raising a human and a gift of life that should have some kind of change, right? And in America, it's just a different story, just using it. And I wonder if that's kind of subliminally, that languaging is subliminally adding to the problem, if that makes sense.
Yeah, I think, whether we're talking about breast implant illness or aesthetic plastic surgery, which you're referencing, and whether it's a mommy makeover or, as you call it, mummy makeover.
Well, but they talk about, after I breastfed, this happened. But if you actually full-term breastfeed, and I'm not saying long-term, I'm talking full-term, which means when the mum and bub decide to end, the body can actually come back. But then you need to, that's a whole nother topic, but you need to understand that even if it doesn't, it's still a gift of life.
Absolutely. And the only point I was going to make is, we think as plastic surgeons, and I personally believe that it's up to the patient to make the decision. If they have something that a particular physical appearance related issue that they're not happy about, and they feel that changing that's going to help them feel better, have more confidence, improve their quality of life, then that's what we're here to try to do.
And that's the hardest thing in the world to talk about. These are the discussions, for me, let's address the elephant in the room. Why would a wellness expert even do such a thing? And you'll read in my story, Treasured Chest, it was a trauma-related thing. Lots of readers have gone, hey, I remembered that happened to me too, and I didn't even put two and two together. So it's important to do the deep work holistically, emotionally, and then obviously access certain surgeons like yourself who have a holistic view on the whole thing. So on that note, what would be your wish for the world moving forward in practice?
Yeah, I just think that we need honesty and transparency from the healthcare system and from the leaders in the country, and I think we're kind of heading in the right direction as far as that goes. But
you mean like make America healthy
right,
again? Right.
Yes. but I do think there's a lot of work to be done, and in my opinion, just eliminating some food additives probably is not sufficient. We see toxicity in our food. We see it in our medical devices. I mean, this is not limited to breast implant illness. So I think what we can do as leaders and health professionals in the space is to try to educate the public about making informed decisions with all the appropriate information, so that it's the patient making the decision or the consumer making the decision, understanding, like we say in medicine, risks, benefits, and alternatives to treatment.
Well, the FDA did put a black box warning on the devices. Australia hasn't caught up yet with their TGA black box warning, so hopefully that will happen and have a flow-on effect. With the Make America Healthy Again campaign, I'm actively involved in that, and the education that goes behind that's the only way to change at the grassroots level. I just think it's super important to understand that what we're talking about here is almost like a forever customer type business model. And hopefully, this is the last surgery that they'll have. But watch this space, guys, as you and I have talked about yesterday, the potentiality of having to go back in and remove potentially some more of my capsule.
You want to talk about that?
Well, we'll have to stay tuned and make sure that this is coming up in another interview.
Yes, absolutely. But kind of going back to what we talked about, that's the importance of doing the total capsulectomy, and ideally in an en bloc way. Well,
stay tuned. We are going to, as per Dr. Landon Pryor's recommendations, have me in a new MRI to see if anything is left inside my chest. But we have absolutely thoroughly enjoyed educating you and hopefully entertaining you at the same time. Thank you so much, Dr. Landon Pryor. Very kind words.
My pleasure.
Make sure you subscribe to Well To Do.